our goal to be human, right, is to be a clear conduit to experience the fullest expression of who we are. And I guess, and that's again my interpretation of what you've shared. And then life, right? Life happens and things happen and things take us out of that potential fullest expression. And so really looking at your role as a physician and a doctor and really helping people to get in touch with that so that they can be in touch and live their fullest expression. How do we now start kind of talking to the practicality? Like, how does this work? Like, how do you even go about like, this beautiful, not just theory, but science to explain this, but how does that translate into working with an individual when they're suffering?
Yes, bringing it to the practical level is the most important thing. So I really think that it's just encouraging someone to take a look at what's in there. And really, in order to do that, I think the best way to discover what we've stored in our biofield, in our energetic anatomy, and even what reverberates in our cells is to do a meditative practice. And so that is something I just encourage people to do, is to develop a meditative practice so that they can become familiar with their unique signature, with their unique sound, like the color, the feeling, the sound, the sense of it. And so that it can begin to then determine what's not them, so they can begin to determine what tension they're holding in their body related to a previous experience, or what's getting triggered in a current interaction with someone that's reminding them of a wound from their childhood, or what feelings they have about themselves that are based on beliefs that were set in place early in life, so they can determine if those beliefs serve them anymore. So, but it's really hard to become clear about what's you and what's not you, and whether the beliefs that you hold, especially about yourself, serve you or not, if you're not tuning in. So that's one thing, is that I really encourage people to do that. And then secondly, I think it's incredibly important to cultivate emotional states that are of a higher vibration. So to become aware enough of your thinking and the emotions that those thoughts generate in you, and then critically evaluate whether the emotional vibration of those is serving you or not, because I think there are higher vibrational emotional states that almost have a transmuting effect on the dissonance that's collecting in a person's body and field. And lower vibrational emotional states can create more dissonance. So it's really about self-awareness. And then I also have some practices in my clinic that I do one-on-one with people, where I have a procedure that I do called OCMOS. And that's been a game changer for many of my patients, where I'm using an instrument that's called a Lecker antenna, and it measures the human bioffield at different frequencies, and I can tell if it's out of balance or not. And then we kind of dive deeply into figuring out what pieces of misinformation are lodged in the field that are throwing off the biofield, and then we work on drawing those out of the system. And unwinding the compensation a person's body has had to do around all of that. So that's a beautiful process. That's a one-on-one kind of therapy that I do with people. But this kind of thing can be done on your own as well. And it's really just about tuning in, figuring out what's there, grounding it off, and becoming aware of whatever it was there to teach you.